Hello and welcome. My name is Sarah Solano, a student at the California State University East Bay. I'm presenting to you Medical Humanity, which I have titled Humanities and Sensibility. I'm also sharing to you a quote by John Gregory, and it goes, "Of the physician's character, the chief quality is humanity, the sensibility of heart which makes us feel for the distress of our fellow creatures." What is humanity? According to the University of Southern California, Dornsife, Dana and David Dornsife, it is an interdisciplinary field of inquiry into medical, education, and healthcare. It brings cohesive experience and ideas of a range of disciplines, including medicine, humanities, social sciences, and arts, as well as the valuable perspectives of patients. Medical humanities scholars provide insight into the social, cultural, philosophical, historical, visual, literary, religious, and bioethical dimensions of medical experiences today in order to cultivate more human, ethical, and self reflective practices in medicine. So, medical humanity is a must to future health professionals. In 2015, the MCAT exam has added scenarios of how well potential medical students' knowledge of humanities. I have a clip of an interview for you, which is presented by Assistant Professor Douglas Dellins at the Ohio Northern University and a junior student's experiences, who she's expressing her point of view of what she has learned thus far as a health professional student.
And become a better nurse. But if she hadn't realized if Edna had not lived above her, do you really think she'd ever become a better nurse?
How cruel she had been to her. So I do still think it would have affected her and probably followed her.
What does it mean to be human? And healthcare has a tremendous part in that. The way in which doctors treat us ethically, the ways in which they treat us interpersonally, the way they treat us culturally. All of this goes back, to me at least, to the humanities: literature, philosophy, film, in the social sciences, in psychology, in sociology, and in philosophy.
Medical humanities are just a better way of looking at how to care for somebody. We talk a lot in class about the difference between a healer and healing. And so I feel like that just opened up my eyes to what as a medical professional you're supposed to be doing for people. You're not supposed to just be applying textbook knowledge, but actually caring for them as a whole person.
What ONU is doing is it's responding to a 21st century need for doctors who can deal with issues of diversity, who can deal with issues of ambiguity, who can think critically on their feet. And I do think that that's something that sets us apart from others.
What you're going into without.
So, what is medical humanity and what are current problems or concerns that pose for this matter? On this left picture, it depicts a physician engulfed with a patient's chart. The issue here is that she should need to be listening to the patient and not about reading the chart. The slide to your right presented physicians making their rounds to patients' rooms. This picture portrays physician's face buried on the physician's chart notes, thus loses in-depth patient-physician relationship. And in the bottom middle comic strip shows a gang of modern team members who confers to each other on how to treat the disease. We have health professionals such as the doctors and nurses, case manager, utilization, insurance. And in the midst of all this, we have the patient who is definitely just lost because of all through all this bureaucracy. Expressing art through humanity. According to Dalhousie University in Halifax, Nova Scotia, Canada, when the name Leonardo da Vinci comes up, the Mona Lisa artwork probably comes up to mind. Not only Da Vinci is an artist, he is also an anatomist. Da Vinci is the first one to discover that human heart has four chambers and not two. Da Vinci is a perfect example of understanding what medicine can emerge through visual art. For this art, to me, it expresses humans reach out for deeper connection. And to your right, we have a doctor holding the hand of a patient. The doctor is basically just reaching out to the patient and providing comfort and empathy. And speaking of doctors, we have Dr. Abraham Verghese from TED Talk from previous discussion. For this presentation, it touched me because he is an epitome of medical humanity, where he still does his ritual of touching and checking his patient's body for any abnormalities. What sticks out to me on his talk is his last appointment with his dying patient of who has AIDS, and the patient has offered his chest to do Dr. Verghese's normal rituals. On the bottom left hand corner, we have the nurse patient care relationship, making sure that the nurse is providing 100% attention to the patient's needs. And then we have in the middle right is music and brain, which is music is significant in healing. And it has been shown that musical sounds has healing powers to the mind and the soul of a human being. And we have here is medical humanity as a philanthropist. In the University of Texas Health Science of San Antonio, they have a new tradition that started back on 2002, 2014, which is called, or what they have a theme, hashtag Giving Tuesday. The university pledges to give something back to the community with the support of the Center for Medical Humanities and Ethics Department. With this project, they're basically teaching future physicians compassion in treating patients and supporting the community.
Today, please consider making a gift to the Center for Medical Humanities and Ethics at the UT Health Science Center, San Antonio. Only with your support can we continue to enrich medical student education. I believe that your investment will improve the human condition. Together, we will make lives better.
So I have here a slide of experience of the student. According to this medical student, it is essential to understand as doctor to have a more humanistic approach to patients. She has learned that through visual art, she started to paint the cells and organs of the human body that lie beneath our skin. She appreciates the beauty and the medical humanity. She also stated that medical professionals have textbook knowledge, but zero knowledge on how to treat patients as humans. I have here for you a accredited organization in medical humanity. Flexner 1910, Transform Humanities Education and Acquisition. Humanistic skills are fundamentals to training of doctors. Association of American Medical Colleges, or the AAMC, in 1998. They provided a statement that is important to altruistic and compassionate, empathic, and strive to understand the meaning of patient stories. Accreditation of Council for Graduate Medical Education in 2001. Doctors need to emphasize respect, compassionate, keep patients' integrity, and sensitivity as priorities to patient-centered care. And the following organization also share the same common goals. The Liaison Committee on Medical Education in 2008, Joint Commission on Accreditation of Healthcare Organizations in 2009, United States Medical Licensing Examination in 2009, and the Board of Medical Examiners in 2011. Also in 2011, the AAMC, they've added prioritizing self-awareness and self-reflective practices. And we have here laws in bioethics. In 1847, the American Medical Association, or the AMA, they published the first edition of its Code of Medical Ethics. This code was instrumental in transforming a loose, unstructured, and largely unregulated craft into a learned profession based on scientific principles and devoted to services. In 1947, during this year, following the trial and conviction of 20 Nazi doctors and 3 medical administrators for their role in Finnish medical experiments on concentration camp prisoners, they have implemented the Nuremberg Code requirements for biomedical research on human practices. And in 1970s, biotechnological advances have emerged as well, and several laws of emergencies as well have arisen. In 1972, the Canterbury versus Spence. This law mandates health professionals to truth-telling to get patients' consent. It's a mandatory prerequisite to ethical medical care. In 1973, there's the Roe versus Wade. This ruling was done through the U.S. Supreme Court's decision, favors women's constitutional right to privacy from excessive restrictions on abortions, and up till this day, this law is still trying to be overturned. And in 1976, we have the Tarasoff versus Regents of the University of California. This ruling is in favor of mental health professionals to act and protect patients with credible threat of violence. So for instance, if we have any mental patient that is sharing some suicidal ideation to their mental physicians, the mental professional has the right and the duty to perform any acts of saving this patient's life away from harm's way. Policies of medical humanity. This one applies to health insurance policies. The Affordable Care Act in 2010, also known as Obamacare, this was implemented. However, out-of-pocket costs are still expensive, and not everyone could afford it, especially the low-income families. Due to the health insurance that's being subsidized by the European governments, since it's becoming too expensive, they're now cautiously considering to turn to the market and private sector groups to alleviate the health care cost. And from my conclusion, medical humanity, putting human compassion, empathy, and sensibility in any medical setting. This can be expressed or viewed as a visual art, music, and touched by human hands. It is also good to know that health professionals have the wit to cure or treat a disease. However, as far as focusing on patient-care relationship is still yet to be desired in this modern society. And I also have provided you the errors of lack of modern medical society is due to busyness to treat the disease, getting their journal published, referring to the health professionals, and the lack of hospital staff to attend all patients. And I believe that medical humanity is applied in health facilities, clinics, and hospitals, And lastly, medical humanity is all about the sensibility, altruism to every human beings. And I thank you for listening to my presentation.